A new study out in literally just the last couple of minutes finds women in the hospital are less likely to die if their doctor is a woman. And a doctor's gender also impacts the rate at which people are readmitted, according to the research. Like, you're actually less likely to go back to the hospital if you're treated by a woman. In the U.S. today, just about 40% of active physicians are women. Still, obviously, the minority, but a shift could maybe point to some hope in closing that gap, because about 50% of residents now, doctors in training, are female. I want to get to Dr. Natalie Azar. So super interesting, right? I mean, the top line of this study, help us understand it. Why would it be that having a woman doctor might help women have better outcomes in the hospital?
So the study, it is interesting, Hallie, and it kind of comes on the heels of a lot of research over the last couple of years that does seem to show some gender differences in patient outcomes. And it should be noted that both men and women had a lower 30-day mortality and readmission rates if their doctors were physicians, but the benefit, if you will, or the protection was even more pronounced in female patients, as well as women who were sicker. You know, the study authors basically throw out three possibilities. One is communication, that that men probably don't communicate as well, and maybe they're not getting crucial information that is necessary for appropriate treatment. There's also the issue that male physicians perhaps underestimate a patient's symptom severity, and that could delay treatment. And then the last one kind of makes sense, that in issues where there's a more sensitive nature, maybe GYN issues, that female to female communication and care, actually could impact, outcome.
What about, we've heard for a while now about women, and specifically women of color, going in, raising issues with the doctor, and feeling like they weren't heard, feeling like they weren't believed when they talked about how they were feeling or whatever their health impacts were. Was that a part of this data?
They did not stratify the patients by race. The way this study was conducted was by combing through Medicare claims data. So they're looking at diagnosis codes, they're looking at male, female, and I was just combing through again the study to see whether or not there was any place where they actually could stratify also and look at this from a race-based perspective, because in addition to women, we know that minorities are also more likely to be misdiagnosed and have historically had an issue in the doctor's office, where they're not being heard, that kind of scenario, which we're all too familiar with. I think an important point, Hallie, is that this was inpatient data. This was hospitalists, taking care of patients in the hospital setting. This is not necessarily to generalizable to younger people or people in an outpatient setting. But if it does anything, I think it drives home the point that as a patient, you need to be sure that you are being heard, that you have a good communication, open lines of communication with your doc, because it is so important that you get the correct diagnosis to get you the right care that you need.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.